My name is Hadley Wesson. I'm a general surgeon with the Johns Hopkins Community Physicians Group at Howard County General Hospital. An umbilical hernia is a defect in the abdominal wall lining at the level of the umbilicus or the belly button. Oftentimes, it's been there since birth because in the embryonic stage, when we had an umbilical cord, there was an anatomical opening that allowed the cord to be present. Oftentimes, that opening will close over time, but sometimes it remains open. And if it remains open, abdominal contents can protrude or pop out through that hole, that defect in the abdominal wall. So if a person has one of these hernias, their symptoms can really range from anything from a small bulge at the level of the belly button to a much larger bulge that can even be quite tender and quite uncomfortable to patients. Surgery is indicated for people when the umbilical hernia becomes symptomatic, meaning that they notice that there is a bulge at the level of their belly button and they're concerned about it. It's uncomfortable for them, it's tender, it's bothersome. All these symptoms are suggestive that it's time to get the defect repaired surgically. Here at Howard County General Hospital, we do both open and laparoscopic repairs of umbilical hernias. Should the person be a candidate for a laparoscopic repair, this means that the morning of surgery, they would come in, they would meet with our anesthesiologists, and they would be brought back to the operating room, where once they're asleep and quite comfortable on the operating room table, we would make two small incisions on the side of their abdomen and be able to actually look and see what the hernia defect is from the inside of the abdomen rather than looking down on it from the outside. Through this, we're actually able to not only reduce the contents of the hernia itself, but also do a very comprehensive repair. So what we usually do is repair the hernia primarily, meaning we sew the tissue itself together to fix the hole. And then oftentimes we'll put mesh underneath the repair itself. The mesh reinforces the repair and it reduces the risk of recurrence. Once we've completed the repair and we've been able to look at exactly how the mesh lays on the abdomen using this laparoscopic technique, we'll then awake the person up from general anesthesia. They'll be taken to the recovery room where they'll stay there for a few hours, see how they do. We want to make sure that their pain is well controlled. We want to make sure that they can tolerate some clear liquids. And after that, more times than not, they're able to go home later that afternoon. So for the open approach, more times than not, this procedure does require general anesthesia, but we make sure that in the operating room there are also other types of medications that we administer to make sure their pain is well controlled. That's one of our primary objectives throughout the whole hospital stay. We then make an incision at the level of the umbilicus or the belly button. We find where the hernia is. We fix the defect by suturing the edges together. And depending upon the size of it, we may decide to leave mesh as well. They're taken to the recovery room where they may stay there for a few hours, make sure that, again, their pain is well controlled. They'll go home with some pain medicine as well. And they're usually home by the evening. After After surgery, on average, the recovery from an umbilical hernia repair takes a couple weeks. Oftentimes, the first day is the toughest for the patient, and we're aware of this, and we want to make sure that that first day is okay for the patient. So we use a lot of numbing medicine in the operating room to really make sure that they can get home okay and are comfortable once they get home. Then over the next few days, they'll notice that every day their pain is improved a little bit. We also give them pain medicine to go home with, prescription pain medicine, and oftentimes what they'll find is every day they use less and less, and they can substitute that oftentimes with Tylenol or ibuprofen. Usually you stay out of work for a few days, anywhere from 3 to 5 days, but again, it's really tailored to the individual patient. These hernias can recur. It's a known fact. It's a known complication. It's actually something that we talk to patients about when they come to the office for their initial consultation. So what may cause the hernia to recur? Oftentimes it's about the size of the hernia defect. And what a lot of studies have shown is it will recur based on the repair itself and whether or not we use mesh or not. So oftentimes we do put mesh in, is that extra strength layer to reinforce the repair and minimize the risk of recurrence. Other things that can cause a hernia to recur are instances in which the pressure can increase within your abdominal wall. So what do I mean by that? Any heavy lifting, any strength exercising, especially within those first few weeks when really the tissue needs that time to heal and come together and build a strength layer. Other things that can cause hernias to reoccur are things that are going to decrease the strength layer of the tissue. So smoking, for example, that can be a risk factor for recurrence.